Question 1. The control framework reveals that client presents a dog with a moderate fear-based aggression issue. You have reviewed several recent studies on the efficacy of different desensitization and counter-conditioning protocols for this specific type of aggression. However, the literature presents conflicting results, with some studies showing significant improvement, others showing only marginal gains, and one recent small-scale study suggesting a particular novel approach might be more effective, though it has not yet been widely replicated. The client is eager for a quick and definitive solution. Which of the following approaches best reflects current best practices for an animal behavior consultant in this situation? Option A. Inform the client that the research is too conflicting to provide any reliable guidance and suggest they seek a different professional. Option B. Recommend the novel approach from the small-scale study, as it is the most recent finding and the client is seeking a definitive solution. Option C. Rely primarily on anecdotal evidence and your own past experiences with similar cases, as these often provide more practical insights than academic research. Option D. Conduct a thorough review of the current peer-reviewed literature, critically evaluating the methodologies and findings of each study. Discuss the nuances, limitations, and areas of uncertainty in the research with the client, and collaboratively develop a behavior modification plan based on the most robust and applicable evidence, acknowledging that definitive outcomes cannot be guaranteed. The correct answer is D. Conduct a thorough review of the current peer-reviewed literature, critically evaluating the methodologies and findings of each study. Discuss the nuances, limitations, and areas of uncertainty in the research with the client, and collaboratively develop a behavior modification plan based on the most robust and applicable evidence, acknowledging that definitive outcomes cannot be guaranteed. Explanation. The control framework reveals a common ethical dilemma faced by animal behavior consultants when presented with conflicting research findings. The challenge lies in balancing the client's immediate needs and expectations with the consultant's professional obligation to provide evidence-based guidance. This scenario is professionally challenging because it requires the consultant to critically evaluate the quality and applicability of research, acknowledge the limitations of current knowledge, and communicate complex scientific information to a layperson in a clear and actionable manner, all while maintaining professional integrity and client trust. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based, and client-centered methodology. It involves a systematic review of current literature, a critical assessment of research quality and relevance to the specific case, and a transparent discussion with the client about the nuances and uncertainties. This approach aligns with the ethical principles of the American Veterinary Society of Animal Behavior, AVSAB, which emphasize the importance of using scientifically validated methods and providing clients with accurate, up-to-date information. By acknowledging the limitations of current research and offering a balanced perspective, the consultant upholds their commitment to professional competence and responsible practice. An incorrect approach that relies solely on anecdotal evidence or personal experience fails to adhere to the scientific rigor expected of an animal behavior consultant. This approach risks providing advice that is not supported by robust data, potentially leading to ineffective or even harmful interventions for the animal. It disregards the core principle of evidence-based practice, which is fundamental to the profession. Another incorrect approach that blindly follows the most recent study without critical evaluation is also professionally unacceptable. Science is an evolving field, and a single study, especially if it has methodological flaws or is not yet replicated, should not be the sole basis for intervention. This approach demonstrates a lack of critical thinking and an oversimplification of complex scientific information, potentially leading to misinformed recommendations. A third incorrect approach that dismisses all research that doesn't align with a pre-existing belief system is ethically problematic. This demonstrates confirmation bias and a failure to engage with the scientific process objectively. It undermines the consultant's credibility and their ability to provide objective, evidence-based guidance. Professionals should approach such situations by first identifying the core question or problem presented by the client. They should then conduct a comprehensive literature search using reputable databases and peer-reviewed journals. This search should focus on studies directly relevant to the animal species, age, presenting behavior, and environmental context. Critically evaluating the methodology, sample size, statistical analysis, and potential biases of each study is crucial. The consultant must then synthesize the findings, noting areas of consensus and disagreement within the research. Finally, they should communicate these findings to the client in an understandable way, discussing the strengths and limitations of the evidence, and collaboratively developing a behavior modification plan that is informed by the best available research, tailored to the individual animal and its circumstances, and ethically sound. Question 2. Process analysis reveals a client is seeking immediate solutions for their dog's persistent barking, expressing frustration and a desire for the barking to stop instantly. The client has limited knowledge of canine behavior and is open to various suggestions, but their primary goal is rapid cessation of the vocalization. As an animal behavior consultant, what is the most ethically sound and professionally responsible initial approach to address this client's concern? Option A. Advise the client to simply ignore the barking, assuring them that the dog will eventually stop if not reinforced. Option B. Conduct a comprehensive behavioral assessment to identify the function of the barking, rule out medical causes, and develop a tailored, humane behavior modification plan. Option C. Suggest a popular enrichment toy that has worked for other clients, without a detailed assessment of the dog's specific needs or the context of the barking. Option D. Immediately recommend the use of an electronic bark collar to suppress the vocalizations, explaining it as the quickest way to achieve the client's desired outcome. Correct answer is B. Conduct a comprehensive behavioral assessment to identify the function of the barking, rule out medical causes, and develop a tailored, humane behavior modification plan. Explanation. Scenario analysis. This scenario presents a common implementation challenge for animal behavior consultants, balancing the client's immediate desire for a quick fix with the ethical and scientific imperative to address the underlying behavioral drivers. The client's frustration and desire for immediate suppression of barking, coupled with their limited understanding of canine behavior, creates pressure to adopt simplistic solutions. The professional challenge lies in educating the client, managing their expectations, and ensuring that the chosen intervention is humane, effective, and based on sound behavioral principles, rather than solely on symptom management. This requires strong communication skills, patience, and a commitment to evidence-based practice. Correct approach analysis. The correct approach prioritizes understanding the function of the barking before implementing any intervention. This aligns directly with the core principles of animal behavior consulting, which emphasize identifying the antecedent and consequence of a behavior to determine its purpose, e.g., attention-seeking, fear, territoriality, boredom. By gathering detailed history, observing the dog in its environment, and considering potential underlying medical issues, the consultant establishes a foundation for developing a behavior modification plan that addresses the root cause. This is the most ethical and effective long-term strategy, promoting the animal's welfare and the human-animal bond, and is consistent with the AVSEB emphasis on humane and science-based methods. Incorrect approaches analysis. One incorrect approach involves immediately recommending aversive tools like bark collars. This fails to address the function of the barking and instead relies on punishment to suppress the behavior. Such methods can lead to increased fear, anxiety, or aggression, and may not resolve the underlying issue, potentially causing more harm than good. This approach violates ethical guidelines that prioritize humane treatment and welfare. Another incorrect approach is to dismiss the client's concerns and simply tell them to ignore the barking. While ignoring a behavior can sometimes be part of a plan, e.g., extinction of attention-seeking behavior, doing so without understanding the function of the barking is irresponsible. If the barking is due to fear or distress, ignoring it will exacerbate the problem and is ethically unacceptable. A third incorrect approach is to suggest a quick fix that doesn't involve a comprehensive assessment, such as recommending a specific toy without understanding the dog's play style or environmental enrichment needs. While enrichment can be part of a solution, it's insufficient as a standalone intervention without a thorough understanding of the dog's individual needs and the specific context of the barking. This approach lacks the depth of analysis required for effective behavior modification. Professional reasoning. Professionals should approach such situations by first establishing rapport with the client and actively listening to their concerns. The next critical step is a thorough assessment, which includes gathering a detailed history, observing the dog's behavior in its natural environment, and ruling out any potential medical causes with a veterinarian. Based on this assessment, The professional can then develop a humane, individualized behavior modification plan that addresses the function of the behavior. This process emphasizes client education, expectation management, and a commitment to the animal's welfare, adhering to the highest ethical and professional standards. Question 3. Risk assessment procedures indicate that a thorough understanding of a dog's typical daily activities, social interactions, and environmental responses is crucial for developing an effective behavior modification plan. The consultant needs to gather detailed, sequential data on the dog's behavior throughout a typical day in its home environment, observing its interactions with family members, other pets, and its responses to common household stimuli. Which behavioral sampling technique would best facilitate the collection of this comprehensive and nuanced data? Option A, continuous sampling of all behaviors. Option B, scan sampling. Option C, focal sampling. Option D, anecdotal observation. The correct answer is C, focal sampling. Explanation: scenario analysis. This scenario presents a common challenge in animal behavior consulting, obtaining accurate and comprehensive data on a dog's behavior in a naturalistic setting without unduly influencing the behavior itself or the owner's perception. The goal is to understand the dog's typical responses to its environment and interactions, which requires a method that minimizes observer bias and captures a representative sample of behaviors. The professional challenge lies in selecting a sampling technique that balances data richness with practicality and ethical considerations for the animal and its caregivers. Correct approach analysis. Focal sampling is the best professional practice in this scenario because it allows for detailed observation of a single subject, the dog, over a defined period. This method is ideal for capturing the full spectrum of behaviors, including subtle interactions and sequences, which are crucial for a thorough behavioral assessment. It minimizes the risk of missing important events that might occur if a broader scan were employed. Ethically, it allows the consultant to focus on the dog's welfare while observing, ensuring the dog is not unduly stressed by the observation process. This approach aligns with the AFSEB emphasis on data-driven, individualized behavior modification plans, which require a deep understanding of the animal's baseline behavior. Incorrect approaches analysis. Using scan sampling would be a regulatory and ethical failure because it involves briefly observing all subjects in a group at predetermined intervals. While useful for prevalence of behaviors in a group, it is insufficient for a detailed assessment of an individual dog's behavioral repertoire, potentially leading to an incomplete or inaccurate diagnosis and treatment plan. This could violate the AFSEB ethical guidelines regarding competent and thorough assessment. Employing continuous sampling for every single behavior would be impractical and potentially overwhelming, leading to observer fatigue and data overload. While it captures all behaviors, its exhaustive nature can compromise the quality of observation and the ability to identify patterns or significant events. This could be considered a failure in professional judgment and efficiency, potentially impacting the client's ability to implement recommendations effectively. Failing to use any systematic sampling technique and relying solely on anecdotal reports from the owner would be a significant ethical and professional failure. Anecdotal data is prone to bias, memory lapses, and subjective interpretation, failing to meet the AFSEB standard for evidence-based practice. This approach would not provide the objective data necessary for a reliable assessment and could lead to misdiagnosis and ineffective interventions, potentially harming the animal and eroding client trust. Professional reasoning. Professionals should approach behavioral assessments by first identifying the specific questions that need to be answered about the animal's behavior. Then, should select the most appropriate sampling technique that can reliably answer those questions within practical and ethical constraints. This involves considering the animal's species, the environment, the specific behaviors of interest, and the resources available. A systematic, objective approach, such as focal sampling for detailed individual assessment, is paramount to providing effective and ethical animal behavior consulting services, adhering to the principles of the AFSEB. Question 4. Comparative studies suggest that the interpretation of behavioral data from a single, brief observation period in a complex social species like canids can be highly variable. When presented with such limited data for a risk assessment, which approach best aligns with professional ethical standards and best practices for animal behavior consulting? Option A. Immediately implement a behavior modification plan based solely on the observed behaviors, assuming they represent the animal's typical repertoire and are the primary concern. Option B. Conduct a thorough risk assessment by integrating the limited observation data with owner-reported history, veterinary records, and an assessment of the animal's environment and social dynamics to form a comprehensive understanding. Option C. Rely primarily on the owner's interpretation of the observed behaviors, as their perspective is the most critical factor in understanding the problem. Option D. Focus exclusively on the most alarming behaviors observed during the short period, prioritizing immediate suppression of these behaviors to mitigate perceived risks. The correct answer is B. Conduct a thorough risk assessment by integrating the limited observation data with owner-reported history, veterinary records, and an assessment of the animal's environment and social dynamics to form a comprehensive understanding. Explanation. Scenario analysis. This scenario is professionally challenging because interpreting behavioral data from a single observation period, especially in a complex social species like canids, requires careful consideration of numerous variables. The risk assessment approach is crucial here, as misinterpreting data can lead to inappropriate intervention strategies, potentially exacerbating the problem or causing harm to the animal or its social group. The limited time frame of observation introduces significant potential for bias and incomplete understanding of the animal's typical behavior, social dynamics, and environmental influences. Correct approach analysis. The correct approach, which involves a comprehensive risk assessment integrating multiple data sources and considering the animal's environment and social context, represents best professional practice. This aligns with the ethical guidelines of the American Veterinary Society of Animal Behavior, AVSAB, which emphasize evidence-based practice and a holistic understanding of animal behavior. Specifically, AVSAB position statements advocate for considering the animal's welfare, the safety of humans and other animals, and the use of humane, science-based methods. A thorough risk assessment, incorporating data from various observation periods, owner reports, veterinary history, and environmental factors, allows for a more accurate diagnosis and the development of effective, ethical, and safe behavior modification plans. This approach minimizes the risk of misdiagnosis and ensures interventions are tailored to the individual animal and its specific circumstances, thereby upholding professional responsibility and animal welfare standards. Incorrect approaches analysis. An approach that relies solely on a single, short observation period without considering broader context is professionally unacceptable. This fails to meet the ethical obligation to gather sufficient information for an accurate assessment. It risks misinterpreting transient behaviors as indicative of a chronic problem or overlooking critical social or environmental triggers. Such an approach could lead to the implementation of ineffective or even detrimental interventions, violating the principle of do no harm and potentially contravening AVSAB emphasis on science-based, humane methods. An approach that prioritizes immediate symptom management without investigating underlying causes or potential risks is also professionally flawed. This superficial approach neglects the complexity of animal behavior and the importance of identifying root causes. It may lead to short-term suppression of behavior without addressing the animal's welfare or the underlying issues, which is ethically questionable and contrary to the principles of effective behavior modification. This can also create a false sense of security while the underlying problem persists or escalates. An approach that focuses exclusively on the owner's perception of the problem without independent, objective data collection is problematic. While owner input is vital, it can be subjective and influenced by their own anxieties or interpretations. Relying solely on this can lead to a biased assessment and interventions that do not accurately reflect the animal's needs or the true nature of the behavior. This deviates from the scientific rigor expected of a behavior consultant and can lead to misdiagnosis and ineffective treatment plans. Professional reasoning. Professionals should adopt a systematic and evidence-based approach to interpreting behavioral data. This involves 1. Gathering comprehensive information, including multiple observation periods, owner interviews, veterinary records, and environmental assessments. 2. Employing a risk assessment framework to evaluate the potential for harm to the animal, humans, and other animals. 3. Differentiating between normal species-typical behaviors and problematic behaviors. 4. Identifying potential underlying causes, including medical, environmental, and social factors. 5. Developing a behavior modification plan that is humane, effective, and tailored to the individual animal and its circumstances, with clear goals and methods for monitoring progress. This structured decision-making process ensures that interventions are ethically sound, scientifically supported, and prioritize the welfare of the animal. Question 5. Assessment of a client's dog's reaction to a new household appliance reveals initial avoidance and vocalizations. Over several days of the appliance being present but not actively used, the dog's avoidance lessens, and vocalizations cease when the appliance is in the room. The behavior consultant needs to determine the most likely underlying learning process to guide intervention. Which of the following best describes the observed phenomenon and its implication for intervention? Option A. The dog is likely sensitizing to the appliance, indicating that further exposure without a counter-conditioning protocol could increase fear and anxiety. Option B. The dog is exhibiting classical conditioning, meaning the appliance is now a conditioned stimulus associated with an unconditioned stimulus that needs to be identified. Option C. The dog is demonstrating operant conditioning, where the avoidance behavior is being negatively reinforced by the removal of the appliance from its presence. Option D. The dog is likely habituating to the appliance, suggesting that continued neutral exposure without direct interaction may be sufficient to resolve the avoidance behavior. The correct answer is D. The dog is likely habituating to the appliance, suggesting that continued neutral exposure without direct interaction may be sufficient to resolve the avoidance behavior. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal behavior consultant to differentiate between two fundamental learning processes, habituation and sensitization, in a client's pet. Misinterpreting these processes can lead to inappropriate intervention strategies, potentially exacerbating the problem or causing distress to the animal. The consultant must apply theoretical knowledge to a real-world behavioral observation, considering the animal's welfare and the client's goals. Correct approach analysis. The correct approach involves systematically evaluating the animal's response to repeated exposure to a stimulus. Habituation is characterized by a decreased response to a stimulus after repeated, non-consequential presentations. Sensitization, conversely, involves an increased response to a stimulus after repeated presentations, often due to the stimulus being aversive or arousing. A professional consultant would observe the dog's reaction to the vacuum cleaner over several sessions, noting if the initial fear or avoidance diminishes with consistent, neutral exposure. This aligns with best professional practice by prioritizing evidence-based assessment and intervention, ensuring the chosen strategy is tailored to the specific learning process at play and promotes the animal's well-being. The American Veterinary Society of Animal Behavior, AVSAB, emphasizes the use of humane and effective methods, which necessitates accurate identification of the underlying behavioral mechanisms. Incorrect approaches analysis. One incorrect approach would be to immediately implement desensitization and counter-conditioning without first establishing whether the dog is habituating or sensitizing. This is a regulatory and ethical failure because it bypasses the crucial diagnostic step of behavioral assessment. AVSAB guidelines stress the importance of a thorough evaluation before recommending interventions. Implementing a treatment protocol without a clear understanding of the learning process is not evidence-based and could be ineffective or even harmful. Another incorrect approach would be to assume that any reduction in a fearful response is automatically habituation, without considering the possibility of sensitization. This is an ethical failure as it demonstrates a lack of critical analysis and a potential disregard for the animal's welfare. If the dog is actually sensitizing, continued exposure, even if seemingly less intense, could increase its anxiety and fear, leading to a worsening of the problem. This violates the AVSAB principle of promoting animal welfare. A third incorrect approach would be to rely solely on the client's subjective interpretation of the dog's behavior without independent observation and assessment. While client input is valuable, a professional consultant must conduct their own objective evaluation. This is a professional and ethical failure as it abdicates the responsibility of expert assessment and could lead to misdiagnosis and inappropriate treatment plans, failing to meet the standards of professional conduct expected by AVSAB. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a comprehensive history and observation. This involves defining the target behavior, identifying the stimulus, and observing the animal's response over repeated exposures. The consultant should then analyze these observations to determine if the response is decreasing habituation or increasing sensitization. Based on this determination, an appropriate intervention plan can be developed, prioritizing humane and effective techniques aligned with AFSEB principles. This iterative process of assessment, intervention, and reassessment ensures that the animal's needs are met and that the consultant is acting within ethical and professional boundaries. Question 6. When evaluating a client's request to rapidly integrate two newly acquired puppies and a litter of kittens into a household with existing adult pets, prioritizing immediate social harmony over the critical developmental windows for socialization, what is the most ethically and professionally responsible course of action for an AFSEB-certified animal behavior consultant? Option A. Advise the client to immediately house all animals together to allow them to figure it out naturally, as this is the quickest way to establish a social hierarchy and prevent future territorial disputes. Option B. Recommend aversive training techniques to quickly suppress any signs of fear or aggression during initial introductions, ensuring that the animals learn to tolerate each other through dominance-based methods. Option C. Focus exclusively on obedience commands for the puppies and basic litter box training for the kittens, assuming that mastering these skills will automatically lead to positive social integration with all household members. Option D. Develop a phased, gradual introduction plan that prioritizes positive, controlled exposures to new people, environments, and other animals, while educating the client on the critical importance of these early experiences for long-term behavioral health and managing expectations regarding immediate perfect integration. Correct answer is D. Develop a phased, gradual introduction plan that prioritizes positive, controlled exposures to new people, environments, and other animals, while educating the client on the critical importance of these early experiences for long-term behavioral health and managing expectations regarding immediate perfect integration. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs of a client with the long-term welfare of the animals, all within the ethical and professional guidelines of an animal behavior consultant. The client's desire for a quick fix conflicts with the nuanced and time-sensitive nature of proper socialization. The consultant must navigate this by prioritizing evidence-based practices and the well-being of the puppies and kittens over the client's potentially misinformed or impatient demands. The correct approach represents best professional practice because it adheres to the core principles of animal welfare and ethical conduct expected of an AFSEB-certified professional. It prioritizes a gradual, controlled, and positive introduction to a variety of stimuli, which is crucial for developing well-adjusted adult animals. This approach is grounded in scientific understanding of critical socialization periods and aims to prevent future behavioral issues, thereby upholding the professional's responsibility to the animal's welfare. It also involves educating the client, which is a key component of responsible behavior consulting. An incorrect approach that focuses solely on immediate obedience training without considering the developmental stage and the need for broad positive exposure fails to meet the ethical obligation to promote animal welfare. It risks creating fear or anxiety in the young animals by exposing them to overwhelming or negative experiences, potentially leading to behavioral problems later in life. This neglects the fundamental principles of positive socialization and could be seen as a failure to provide competent advice, potentially violating ethical guidelines that emphasize the prevention of suffering and the promotion of well-being. Another incorrect approach that dismisses the client's concerns entirely without offering alternative, evidence-based strategies is professionally unsound. While the client may be misinformed, a consultant's role includes client education and collaborative problem-solving. Ignoring the client's perspective, even if it's based on a misunderstanding, can lead to a breakdown in the professional relationship and may result in the client seeking less reputable advice, ultimately harming the animals. This demonstrates a lack of client management skills and a failure to uphold the professional's duty to guide and educate. A professional decision-making process for similar situations should begin with a thorough assessment of the animal's current developmental stage and the client's goals and understanding. The consultant should then clearly articulate the scientific rationale behind recommended socialization protocols, emphasizing the critical nature of the current period. Client education should be a primary focus, explaining the long-term benefits of a well-executed socialization plan and the potential risks of shortcuts. The plan should be collaborative, allowing for client input while maintaining professional oversight to ensure the animal's welfare remains paramount. Open communication and a willingness to address client concerns with evidence-based information are key to successful outcomes. Question 7. Stakeholder feedback indicates a need for animal behavior consultants to more effectively integrate scientific understanding of animal cognition and evolution into their practice. When developing a behavior modification plan for a dog exhibiting excessive barking, which approach best reflects the application of comparative psychology principles relevant to the AVSEB guidelines for animal behavior consultants? Option A. Relying on popular training fads and anecdotal advice from online forums to manage the barking, assuming that human-centric behavioral modification strategies will be universally effective. Option B. Applying human psychological theories of anxiety and attention-seeking directly to the dog's barking, without considering the unique evolutionary history and cognitive abilities of canids. Option C. Prioritizing interventions that leverage the dog's natural pack instincts and communication signals, as understood through comparative studies of canid social behavior, to redirect attention and reduce vocalizations. Option D. Implementing a strict no-barking rule and employing aversive techniques to immediately suppress all vocalizations, regardless of the underlying cause or the dog's species-specific communication needs. The correct answer is C. Prioritizing interventions that leverage the dog's natural pack instincts and communication signals, as understood through comparative studies of canid social behavior, to redirect attention and reduce vocalizations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal behavior consultant to integrate principles from comparative psychology into their practice, while adhering to the ethical and regulatory guidelines of the American Veterinary Society of Animal Behavior, AVSEB. The challenge lies in translating theoretical knowledge of animal cognition and evolution into practical, evidence-based behavior modification plans that are safe, effective, and ethically sound for individual animals and their owners. This application of comparative psychology can lead to anthropomorphism, inappropriate interventions, or a failure to consider the species-specific needs and evolutionary history of the animal, potentially causing harm or hindering progress. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the AVSEB emphasis on science-based, humane, and effective animal behavior modification. By grounding interventions in comparative psychology, the consultant can better understand the evolutionary underpinnings of a behavior, predict how an animal might learn and respond to different stimuli, and tailor interventions to the species' natural repertoire and cognitive abilities. This approach prioritizes the animal's welfare by avoiding interventions that are counter-evolutionary or that ignore the species' natural behaviors and motivations, thereby promoting a more holistic and effective behavior modification plan. This aligns with the AVSEB commitment to evidence-based practice and the welfare of animals. Incorrect approaches analysis. An approach that relies solely on anecdotal evidence or popular trends, without considering the scientific literature from comparative psychology, fails to meet the AVSEB standard for evidence-based practice. This can lead to the use of ineffective or even harmful techniques that are not supported by scientific understanding of animal behavior. Ethically, it breaches the duty to provide competent and informed care. An approach that prioritizes human convenience over the animal's species-specific needs, as informed by comparative psychology, is ethically problematic. For example, forcing an animal to suppress natural behaviors without providing appropriate outlets or understanding the underlying motivations, as revealed by comparative studies, can lead to increased stress, anxiety, and the development of more severe behavioral issues. This violates the principle of animal welfare. An approach that applies human psychological models directly to animals without considering species differences, as highlighted by comparative psychology, is a common pitfall. This anthropomorphic tendency can lead to misinterpretations of animal behavior and the implementation of inappropriate interventions. Ethically, it demonstrates a lack of understanding of animal cognition and can result in ineffective or detrimental treatment plans. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough assessment of the animal's behavior, considering its species, breed, age, history, and environmental context. This assessment should be informed by current scientific literature, including research in comparative psychology, ethology, and learning theory. Interventions should then be developed based on this evidence, prioritizing humane and effective methods that respect the animal's species-specific needs and evolutionary background. Continuous learning and staying abreast of scientific advancements are crucial for providing the highest standard of care and upholding ethical obligations. Question 8. Risk assessment procedures indicate that a client's dog exhibits significant avoidance and fear responses, specifically towards a particular squeaky toy. Yet the owner reports no instances where the dog itself has directly experienced any negative consequences from this toy. However, the owner does recall observing a different dog in their household previously react with extreme distress and vocalization when this same toy was presented. Based on these observations, which of the following is the most likely explanation for the current dog's behavior and the most appropriate initial approach for the behavior consultant? Option A. The dog has a generalized phobia of squeaky objects, and a broad fear reduction protocol for all squeaky items should be implemented immediately. Option B. The dog has learned to fear the toy through observational learning, having witnessed the other dog's negative experience, and the intervention should focus on desensitization and counter-conditioning to the toy, starting with very low intensity. Option C. The owner's observation of the other dog is irrelevant, and the consultant should proceed with a standard operant conditioning program to extinguish the avoidance behavior through repeated exposure and reinforcement of calm behavior. Option D. The dog is exhibiting a learned helplessness response, and the primary intervention should involve forcing the dog to interact with the toy until it ceases its avoidance. The correct answer is B. The dog has learned to fear the toy through observational learning, having witnessed the other dog's negative experience, and the intervention should focus on desensitization and counter-conditioning to the toy, starting with very low intensity. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal behavior consultant to differentiate between a dog's learned behaviors stemming from direct experience versus those acquired through observing others. Misinterpreting the source of the behavior can lead to ineffective or even detrimental intervention strategies, potentially exacerbating the problem or creating new ones. The consultant must apply theoretical knowledge of observational and social learning to a real-world situation, considering the nuances of canine social dynamics and individual learning histories. Correct approach analysis. The correct approach involves recognizing that the dog's avoidance of the specific toy is likely a result of witnessing another dog's negative experience with it. This aligns with social learning theory, specifically observational learning, where an individual learns by watching the actions of others and the consequences of those actions. By identifying this observational learning, the consultant can then develop a targeted desensitization and counter-conditioning protocol that addresses the learned association without requiring the dog to have had a direct negative experience itself. This is best professional practice as it is grounded in established behavioral science principles and leads to a more efficient and humane resolution. Incorrect approach is analysis. One incorrect approach would be to assume the dog has a generalized fear of all toys and to implement a broad, non-specific fear reduction protocol. This fails to acknowledge the specific nature of the learned avoidance, which is tied to observation rather than direct experience. Ethically, this is problematic as it may be unnecessarily time-consuming and stressful for the dog and owner, and it doesn't leverage the most direct path to resolution based on the identified learning mechanism. Another incorrect approach would be to focus solely on the dog's current fearful reaction without investigating its origin, perhaps by recommending immediate punishment for the avoidance behavior. This is a significant ethical failure. Punishment for a fear-based avoidance behavior, especially one learned through observation, is not only ineffective but can also increase fear and anxiety, potentially leading to aggression. It directly contradicts the principles of positive reinforcement and humane treatment central to ethical animal behavior consulting. A further incorrect approach would be to dismiss the owner's observation about the other dog's experience as irrelevant and to proceed with a trial-and-error approach to identify the cause of the avoidance. This demonstrates a lack of analytical rigor and a failure to integrate client-provided information, which is a crucial part of the assessment process. It also risks delaying effective intervention and potentially causing unnecessary distress. Professional reasoning. When faced with a behavior that appears learned but lacks a clear history of direct negative reinforcement for the individual, professionals should consider observational and social learning. The process involves 1. Gathering a thorough history from the owner, including any observed interactions with other animals. 2. Observing the dog's behavior in context, noting triggers and responses. 3. Hypothesizing potential learning mechanisms, including direct experience, classical conditioning, operant conditioning, and social learning. 4. Designing an intervention plan that directly addresses the hypothesized mechanism. And 5. Monitoring progress and adjusting the plan as needed. In this case, the owner's report of another dog's negative experience with the toy is a critical piece of information pointing towards observational learning. Question 9. Upon reviewing a client's report detailing their dog's persistent vocalizations during thunderstorms, which the owner describes as constant barking and whining, the animal behavior consultant must determine the most appropriate initial course of action. The owner expresses significant distress, stating, "He's just so loud and won't stop. It's driving us crazy." The dog is otherwise reported to be healthy, with no recent changes in diet or routine, and has a history of being a generally well-behaved pet. Option A. Advise the owner that the dog is simply exhibiting a normal species-typical response to a natural phenomenon and that they will need to learn to tolerate the noise. Option B. Suggest immediate pharmacological intervention to sedate the dog during thunderstorms without further behavioral assessment. Option C. Immediately recommend a comprehensive veterinary examination to rule out any underlying medical causes for the increased vocalization, while also acknowledging the owner's distress and explaining that thunderstorm phobia is a common behavioral issue that requires a multifaceted approach. Option D. Label the barking and whining as a sign of aggression and recommend confinement to a separate room until the storm passes. The correct answer is C. Immediately recommend a comprehensive veterinary examination to rule out any underlying medical causes for the increased vocalization, while also acknowledging the owner's distress and explaining that thunderstorm phobia is a common behavioral issue that requires a multifaceted approach. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the behavior consultant to differentiate between a normal species-typical behavior and a behavior that may indicate underlying distress or a need for intervention. Misinterpreting the behavior could lead to inappropriate recommendations, potentially exacerbating the problem or failing to address a welfare concern. The consultant must apply a nuanced understanding of animal behavior within the context of the specific species and individual animal. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the behavior within its broader context. This includes evaluating the animal's environment, social interactions, physical health, in consultation with a veterinarian, and the specific triggers for the behavior. This aligns with the ethical and professional standards of the American Veterinary Society of Animal Behavior, AVSAB, which emphasizes evidence-based practices and a holistic understanding of animal behavior. The scope of animal behavior, as understood by AVSAB, extends beyond simply identifying a behavior to understanding its function, motivation, and potential impact on welfare. Incorrect approaches analysis. One incorrect approach would be to immediately label the behavior as problematic and recommend immediate, drastic interventions without thorough investigation. This fails to acknowledge that many species-typical behaviors, while perhaps inconvenient to owners, are not inherently indicative of distress or pathology. Ethically, this could lead to unnecessary stress for the animal and owner, and it violates the principle of do no harm. It also demonstrates a superficial understanding of the definition and scope of animal behavior, focusing only on the observable action rather than its underlying causes or functional significance. Another incorrect approach would be to dismiss the owner's concerns entirely, stating that the behavior is normal without further investigation. Some behaviors are indeed normal. An owner's perception of a problem often stems from a mismatch between the animal's behavior and the owner's expectations or environment. A professional must explore this mismatch and provide guidance, even if the behavior itself is species-typical. Failing to do so neglects the owner's welfare and the human-animal bond, which are integral to successful behavior modification. This approach also limits the scope of practice by not considering the behavioral needs of the animal within its domestic environment. A third incorrect approach would be to focus solely on the physical health aspect and refer the animal to a veterinarian without conducting any behavioral assessment. While veterinary consultation is crucial, it is only one piece of the puzzle. Many behavioral issues are not primarily medical. This approach abdicates the responsibility of the behavior consultant to assess and address behavioral factors, potentially delaying appropriate behavioral interventions. It misunderstands the scope of animal behavior as a distinct field of expertise that complements but does not replace veterinary medicine. Professional reasoning. Professionals should employ a systematic approach. First, actively listen to and validate the owner's concerns. Second, gather detailed information about the behavior, including its frequency, duration, triggers, and the context in which it occurs. Third, conduct a thorough behavioral assessment, considering the species, breed, age, individual history, and environmental factors. Fourth, collaborate with a veterinarian to rule out any underlying medical conditions. Fifth, based on the comprehensive assessment, develop a behavior modification plan that is humane, effective, and tailored to the specific animal and owner, always prioritizing the animal's welfare and the human-animal bond. This process ensures that interventions are evidence-based and ethically sound, respecting the broad definition and scope of animal behavior. Question 10. During the evaluation of a client whose dog exhibits excessive barking when left alone, you observe the owner using a citronella collar that sprays the dog when it barks. The owner states this is the only thing that has worked to reduce the barking, though the dog still barks intermittently and appears anxious when the collar is on. The owner is seeking further advice on how to eliminate the barking completely. What is the most appropriate course of action for the animal behavior consultant? Option A. Focus solely on identifying environmental triggers for the barking and suggest management strategies without addressing the client's current training methods. Option B. Recommend a different type of aversive collar, such as an electronic shock collar, as it may be more effective in suppressing the barking. Option C. Advise the client to continue using the citronella collar, as it has shown some reduction in barking, and suggest increasing the frequency of collar activation. Option D. Explain the principles of positive reinforcement and how it can be used to address separation anxiety-related barking, while also discussing the potential negative welfare impacts and limited long-term efficacy of punishment-based methods like the citronella collar. The correct answer is D. Explain the principles of positive reinforcement and how it can be used to address separation anxiety-related barking, while also discussing the potential negative welfare impacts and limited long-term efficacy of punishment-based methods like the citronella collar. Explanation. Scenario analysis. This scenario presents a common challenge in animal behavior consulting. A client is using aversive techniques that are not only ineffective but also potentially harmful to the dog's welfare and the human-animal bond. The consultant must navigate the client's existing practices, their understanding of behavior modification, and the ethical imperative to promote humane and evidence-based methods. The challenge lies in educating the client and guiding them toward more effective and ethical solutions without alienating them or compromising the animal's well-being. Correct approach analysis. The correct approach prioritizes the animal's welfare and adheres to the ethical guidelines of the American Veterinary Society of Animal Behavior, AVSEB. It involves a thorough assessment to understand the underlying reasons for the behavior and the client's current methods. The consultant then educates the client on the principles of operant conditioning, specifically highlighting the detrimental effects of punishment and the benefits of positive reinforcement. This approach is best professional practice because it is grounded in scientific evidence, promotes humane treatment, and aims to build a stronger, more trusting relationship between the dog and owner. It directly addresses the problematic use of punishment by offering a scientifically supported, welfare-focused alternative. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the client's current methods without understanding the context or offering alternatives. This fails to meet the ethical obligation to educate and guide the client, potentially leading to the client abandoning professional help or continuing harmful practices. It also disregards the client's perspective and may create an adversarial relationship, hindering progress. Another incorrect approach is to simply tell the client to stop using punishment without explaining why or providing a viable alternative. This lacks the educational component crucial for behavior modification and client compliance. The client may not understand the rationale, leading to continued use of punishment or a lack of confidence in the consultant's recommendations. A third incorrect approach is to focus solely on the dog's behavior without addressing the client's methods and understanding of operant conditioning. This misses a critical opportunity to correct the application of punishment, which is likely contributing to or exacerbating the problem. It fails to provide a comprehensive solution that addresses both the symptom, the behavior, and the cause, the inappropriate training method. Professional reasoning. Professionals should approach such situations with empathy and a commitment to evidence-based practice. The decision-making process involves 1. Active listening and thorough assessment to understand the client's goals, the dog's history, and current training methods. 2. Educating the client on the principles of animal behavior and learning theory, emphasizing the scientific consensus on the efficacy and welfare implications of positive reinforcement versus punishment. 3. Collaboratively developing a behavior modification plan that prioritizes humane, science-based techniques and clearly outlines the rationale for avoiding punishment. 4. Providing ongoing support and monitoring progress, adjusting the plan as needed. Question 11. The audit findings indicate a pattern of mischaracterizing canine aggression in client cases, with a tendency to label all aggressive displays as simply dominance aggression, without further differentiation. This has led to inconsistent and often ineffective management strategies being recommended. Which of the following assessment and intervention approaches best addresses these audit findings and aligns with professional best practices for animal behavior consultants? Option A. Implement immediate punishment-based techniques to suppress all aggressive vocalizations and physical displays, assuming this will quickly re-establish the desired social hierarchy. Option B. Conduct a detailed behavioral history and direct observation to identify the specific type of aggression, e.g., fear-based, territorial, resource guarding, and its underlying motivators. Then develop a behavior modification plan that addresses these specific causes using positive reinforcement and management strategies. Option C. Recommend a blanket ban on all interactions with other animals and people, attributing the aggression solely to the dog's inherent disposition without further investigation. Option D. Focus solely on desensitization exercises without addressing the underlying emotional state or potential triggers identified in the client's history, believing that repeated exposure will resolve the issue. The correct answer is B. Conduct a detailed behavioral history and direct observation to identify the specific type of aggression, e.g., fear-based, territorial, resource guarding, and its underlying motivators. Then develop a behavior modification plan that addresses these specific causes using positive reinforcement and management strategies. Explanation. Scenario analysis. This scenario presents a common challenge for animal behavior consultants, differentiating between various forms of aggression and identifying the underlying causes. The audit findings highlight a potential gap in diagnostic accuracy and intervention planning, which could have significant implications for animal welfare and public safety. The professional challenge lies in moving beyond superficial observation to a nuanced understanding of the behavior, considering the specific context, triggers, and the individual animal's history and emotional state. Misclassifying aggression can lead to ineffective or even detrimental management strategies, potentially exacerbating the problem or creating new ones. Correct approach analysis. The correct approach involves a comprehensive assessment that prioritizes identifying the specific type of aggression and its primary motivators. This aligns with best practices in animal behavior consulting, emphasizing a science-based, individualized approach. By focusing on the underlying causes, such as fear, territoriality, or resource guarding, the consultant can develop targeted and effective management and behavior modification plans. This approach is ethically sound as it aims to improve the animal's welfare by addressing the root of the problem and is consistent with the professional standards of the American Veterinary Society of Animal Behavior, AVSAB, which advocates for humane and evidence-based interventions. Incorrect approaches analysis. An approach that focuses solely on suppressing outward signs of aggression without investigating the underlying causes is ethically problematic. It fails to address the animal's emotional state and can lead to the development of more severe or generalized anxiety-related behaviors, or a redirection of the aggressive response to a different, potentially more dangerous outlet. This is a failure to adhere to the principle of promoting animal welfare. An approach that relies on punishment-based methods to manage aggression is also ethically and professionally unacceptable. Such methods can increase fear and anxiety, thereby escalating aggression, and are contrary to the humane and science-based principles promoted by professional organizations like AFSAB. Furthermore, it can create a negative association with the handler or environment, further complicating behavior modification. An approach that attributes aggression to a single, simplistic cause without considering the interplay of multiple factors, e.g., genetics, environment, learning history, is a failure of thorough assessment. This oversimplification can lead to incomplete or ineffective treatment plans, potentially putting the animal and others at risk. It demonstrates a lack of the deep analytical skill required for effective behavior consulting. Professional reasoning. Professionals should approach aggression cases by first conducting a thorough history intake, followed by direct observation of the animal and its environment. This allows for the identification of specific triggers, the context of the aggressive episodes, and the animal's body language. The next step is to hypothesize potential underlying causes and types of aggression, e.g., fear aggression, territorial aggression, predatory aggression, interdog aggression. Based on this assessment, a behavior modification plan should be developed that addresses the identified causes, prioritizes positive reinforcement and counter-conditioning techniques, and includes management strategies to prevent exposure to triggers while the behavior is being modified. Regular reevaluation of the plan and the animal's progress is crucial. Question 12. Consider a scenario where a client presents their dog for what they describe as stubbornness and disobedience during walks, expressing frustration and a desire for a quick fix. The veterinarian suspects underlying anxiety or fear-based behaviors are contributing to the dog's reactions, but the client is insistent on immediate obedience training techniques. What is the most appropriate initial course of action for the veterinarian to ensure the animal's welfare and provide effective guidance? Option A. Conduct a thorough behavioral history and observation, perform a risk assessment for potential safety concerns, and explain the importance of understanding the underlying causes of the behavior before recommending specific interventions, even if it means delaying immediate obedience training. Option B. Agree to the client's request for immediate obedience training techniques, as client satisfaction is paramount in veterinary practice. Option C. Advise the client that the veterinarian's role is limited to medical issues and recommend they seek a certified professional dog trainer for obedience issues, without further behavioral assessment. Option D. Immediately prescribe anxiety medication to address the client's perceived problem, as this will likely calm the dog and make it more receptive to obedience training. The correct answer is A. Conduct a thorough behavioral history and observation, perform a risk assessment for potential safety concerns, and explain the importance of understanding the underlying causes of the behavior before recommending specific interventions, even if it means delaying immediate obedience training. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a potential conflict between immediate client demands and the long-term welfare and safety of an animal. The veterinarian is faced with a situation where a client's perception of a problem may not align with objective behavioral assessment, and the consequences of misdiagnosis or inappropriate intervention can range from ineffective treatment to severe harm to the animal or human safety. The veterinarian must navigate client expectations, their own professional expertise, and the ethical imperative to act in the animal's best interest, all within the framework of veterinary practice guidelines. Correct approach analysis. The correct approach, which prioritizes a thorough behavioral assessment and risk analysis before recommending interventions, represents best professional practice because it aligns with the core ethical principles of veterinary medicine, particularly beneficence, acting in the animal's best interest, and non-maleficence, avoiding harm. This approach is supported by the American Veterinary Society of Animal Behavior, AFSAB, position statements, which emphasize the importance of evidence-based behavior modification techniques and a comprehensive understanding of the underlying causes of behavior. A risk assessment is crucial for identifying potential dangers to the animal, other animals, or people, allowing for appropriate safety measures to be implemented alongside behavior modification plans. This systematic approach ensures that interventions are tailored to the individual animal and situation, maximizing the likelihood of success and minimizing the risk of adverse outcomes. Incorrect approaches analysis. An approach that immediately prescribes medication without a thorough behavioral assessment and risk analysis is professionally unacceptable. This fails to address the root cause of the behavior, potentially masking underlying issues, and carries the risk of adverse drug reactions or ineffective treatment if the medication is not indicated for the specific behavioral problem. Ethically, it violates the principle of non-maleficence by potentially causing harm through inappropriate medical intervention, and fails to act in the animal's best interest by not seeking to understand and modify the behavior effectively. An approach that dismisses the client's concerns and refuses to engage with the behavior problem is also professionally unacceptable. While the client's perception may be inaccurate, their concerns are valid from their perspective and warrant professional attention. Ignoring these concerns can damage the veterinarian-client relationship, lead to the client seeking unqualified advice, and ultimately result in the animal not receiving appropriate care. Ethically, this approach fails to uphold the veterinarian's duty of care and can be seen as a dereliction of professional responsibility. An approach that relies solely on anecdotal evidence or popular, but unproven training methods without a scientific basis is professionally unacceptable. This can lead to ineffective or even harmful interventions, potentially exacerbating the behavioral issue or causing distress to the animal. It deviates from the evidence-based practice expected of veterinary professionals and can undermine the credibility of the profession. Professional reasoning. Professionals should approach such situations by first actively listening to and validating the client's concerns. This is followed by a comprehensive history-taking and a detailed behavioral assessment, which may include observation of the animal and its environment. A critical component of this assessment is a risk analysis to identify any immediate dangers. Based on this comprehensive evaluation, the veterinarian can then formulate a differential diagnosis for the behavioral issue and develop a tailored intervention plan, which may include behavior modification, environmental management, and, if indicated, pharmacological support. This systematic, evidence-based, and ethically grounded approach ensures that the animal's welfare is prioritized and that interventions are safe and effective. Question 13. The review process indicates a growing trend among animal behavior consultants to utilize video analysis and specialized software for behavior assessments. Considering the ethical and practical guidelines for an American Veterinary Society of Animal Behavior Consultant, which approach to integrating these technological tools into behavior assessment is most aligned with best professional practice. Option A. Employing video analysis and software tools as supplementary aids to enhance comprehensive in-person assessments, ensuring data is critically analyzed and client confidentiality is maintained. Option B. Uncritically accepting automated behavioral interpretations generated by software, assuming the technology provides definitive diagnoses. Option C. Solely relying on client-submitted videos for assessment, without any direct in-person observation by the consultant to maximize efficiency. Option D. Sharing client-submitted video data with other professionals for peer review without obtaining explicit client consent to broaden diagnostic perspectives. The correct answer is A. Employing video analysis and software tools as supplementary aids to enhance comprehensive in-person assessments, ensuring data is critically analyzed and client confidentiality is maintained. Explanation. Scenario analysis. This scenario presents a professional challenge due to the increasing reliance on technology for behavior assessment and the need to ensure its ethical and effective application within the scope of the American Veterinary Society of Animal Behavior (AVSAB) Animal Behavior Consultant Guidelines. Consultants must navigate the benefits of technological tools against potential pitfalls like misinterpretation, data privacy concerns, and the risk of over-reliance, which could detract from essential in-person observation and client interaction. The challenge lies in integrating these tools responsibly while upholding the core principles of animal welfare and client trust. Correct approach analysis. The correct approach emphasizes the use of video analysis and specialized software as supplementary tools to enhance, not replace, traditional in-person assessments. This aligns with AVSAB commitment to evidence-based practices and ethical conduct. Video analysis allows for objective, repeatable observation of behavior patterns, providing detailed data that might be missed during a single in-person session. Software tools can aid in organizing this data, identifying trends, and facilitating communication with clients. The key is that these technologies are used to support a comprehensive assessment that still includes direct observation, client history, and environmental evaluation, ensuring a holistic understanding of the animal's behavior and its context. This approach prioritizes data integrity, client confidentiality, as per general ethical guidelines for professional practice, and the consultant's professional judgment in interpreting the findings. Incorrect approach is analysis. One incorrect approach involves solely relying on client-submitted videos without any in-person assessment or direct observation by the consultant. This fails to meet the standard of a comprehensive behavior assessment, as it bypasses crucial elements like direct observation of the animal's response to the consultant, assessment of the home environment in real time, and the opportunity for immediate clarification of client observations. Ethically, this could lead to misdiagnosis or ineffective behavior modification plans, potentially compromising animal welfare. Another incorrect approach is the uncritical acceptance of automated interpretations provided by behavior analysis software without independent verification or professional judgment. While software can identify patterns, it lacks the nuanced understanding of individual animal history, subtle environmental cues, and the emotional state of the animal that a trained consultant possesses. Over-reliance on automated outputs without professional oversight risks misinterpreting behavior, leading to inappropriate recommendations and potentially exacerbating the problem. This also raises ethical concerns regarding professional competence and accountability. A third incorrect approach involves sharing client-submitted video data with third parties, or using it for purposes beyond the direct behavior consultation without explicit, informed consent. This violates general principles of client confidentiality and data privacy, which are implicit in professional conduct guidelines. Even if the technology itself is advanced, its application must adhere to ethical standards of practice regarding client information. Professional reasoning. Professionals should approach the use of technology in behavior assessment with a critical and integrated mindset. The decision-making process involves 1. Evaluating the specific technological tool's suitability for the case and its alignment with AFSEB principles. 2. Determining how the technology can best supplement, not supplant, direct observation and client interaction. 3. Ensuring data privacy and client consent protocols are robust. 4. Critically analyzing and interpreting all data, whether from technology or direct observation, using professional expertise. And 5. Communicating findings and recommendations clearly and ethically to the client, explaining the role of technology in the assessment. Question 14. Which approach would be most appropriate for an animal behavior consultant when a client reports their 12-week-old puppy is exhibiting behaviors such as nipping at heels during play, chewing on furniture, and occasional vocalizations when left alone for short periods? Option A. Prescribe a specific obedience training class that focuses solely on advanced commands, assuming this will address the reported issues. Option B. Immediately implement a strict no-reward training protocol for all behaviors, including nipping and chewing, and recommend confinement for extended periods when the puppy vocalizes. Option C. Advise the owner that these are normal puppy behaviors and no intervention is necessary, as the puppy will outgrow them with time. Option D. Conduct a thorough behavioral history and direct observation of the puppy in its home environment to assess developmental stage, socialization history, and potential triggers for the behaviors. Then develop a tailored, positive reinforcement-based management and training plan. The correct answer is D. Conduct a thorough behavioral history and direct observation of the puppy in its home environment to assess developmental stage, socialization history, and potential triggers for the behaviors. Then develop a tailored, positive reinforcement-based management and training plan. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a young animal exhibiting behaviors that, while potentially normal developmental stages, could also indicate underlying issues or lead to problematic adult behaviors if not managed appropriately. The owner's perception of the behavior as problematic adds pressure to provide a quick fix, but a responsible behavior consultant must prioritize the animal's welfare and long-term behavioral health over immediate owner satisfaction. The consultant must balance the need for intervention with the understanding of normal developmental trajectories. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough, science-based assessment of the puppy's developmental stage and environmental influences. This aligns with the ethical guidelines of the American Veterinary Society of Animal Behavior, AFSEB, which emphasize evidence-based practices and the welfare of the animal. By observing the puppy in its natural environment and gathering detailed history, the consultant can differentiate between normal developmental behaviors and those requiring intervention. This approach allows for tailored recommendations that support healthy development, prevent future problems, and educate the owner on realistic expectations for puppy behavior, thereby fostering a strong human-animal bond based on understanding. Incorrect approaches analysis. One incorrect approach fails by immediately recommending aversive training techniques. This is a regulatory and ethical failure because it contradicts modern, humane, and science-based behavior modification principles advocated by AFSAB. Aversive methods can suppress behavior without addressing the underlying cause, potentially leading to fear, anxiety, aggression, and damage to the human-animal bond. It also fails to consider the puppy's developmental stage, which may require management and positive reinforcement rather than punishment. Another incorrect approach is to dismiss the owner's concerns without a proper assessment, stating that all puppy behaviors are normal. This is an ethical failure as it neglects the owner's subjective experience and the potential for early intervention to prevent future, more severe behavioral issues. While some puppy behaviors are normal, a responsible consultant must investigate to ensure they are not indicative of underlying stress, fear, or a lack of appropriate socialization, which could have long-term consequences. A third incorrect approach is to recommend a single, generic training program without considering the specific puppy, its environment, or the observed behaviors. This is a professional failure because it lacks the individualized assessment required for effective behavior modification. It overlooks the critical role of developmental stages, breed predispositions, and individual learning histories, potentially leading to ineffective or even detrimental advice. Professional reasoning. Professionals should approach such situations by first establishing a strong rapport with the owner and then conducting a comprehensive assessment. This assessment should include detailed history-taking, direct observation of the puppy and its environment, and consideration of the puppy's age and developmental stage. Based on this holistic understanding, the consultant can then formulate a behavior modification plan that is humane, effective, and tailored to the individual animal and its family. This process emphasizes education, prevention, and positive reinforcement, aligning with the highest ethical and professional standards. Question 15. Strategic planning requires a behavior consultant to select the most appropriate observational method for assessing a dog exhibiting reactivity towards other dogs in a park setting. Considering the need for objective data collection and the potential for environmental influences, which of the following observational approaches would best align with established ethical and scientific guidelines for behavior assessment? Option A. Developing a detailed ethogram of specific reactive behaviors, e.g., lunging, barking, stiffening, and conducting systematic, timed observations of the dog's interactions with other dogs in the park, recording the frequency, duration, and intensity of these behaviors. Option B. Relying solely on the owner's descriptions of the dog's behavior during previous encounters with other dogs, without direct observation. Option C. Implementing a highly intrusive observation method that involves the consultant actively provoking interactions between the dog and other dogs to elicit a strong reaction for detailed study. Option D. Conducting a brief, unstructured observation session where the consultant casually watches the dog in the park for a few minutes without a specific plan or recording method. The correct answer is A. Developing a detailed ethogram of specific reactive behaviors, e.g., lunging, barking, stiffening, and conducting systematic, timed observations of the dog's interactions with other dogs in the park, recording the frequency, duration, and intensity of these behaviors. Explanation. Scenario analysis. This scenario presents a common challenge in behavior assessment where a consultant must choose the most appropriate observational method for a specific case. The difficulty lies in balancing the need for detailed, objective data with the practical constraints of the environment and the animal's welfare. A hasty or inappropriate choice can lead to inaccurate assessments, ineffective behavior modification plans, and potential harm to the animal or its handlers, all of which have ethical and professional implications. Correct approach analysis. The correct approach involves selecting an observational method that is both scientifically sound and ethically appropriate for the specific context. This means considering the type of behavior being assessed, the environment in which it occurs, the resources available for observation, and the potential impact on the animal. For instance, Using a structured, ethogram-based observation in the animal's natural environment allows for the collection of objective, quantifiable data on specific behaviors, which is crucial for accurate diagnosis and effective intervention planning. This aligns with the AVSEB emphasis on science-based methods and the ethical imperative to minimize stress and maximize welfare during assessment. Incorrect approaches analysis, an approach that relies solely on anecdotal reports from owners without direct observation, fails to meet the AVSEB standards for objective assessment. Anecdotal data is prone to bias, misinterpretation, and memory lapses, making it unreliable for developing evidence-based behavior modification plans. This constitutes an ethical failure by not prioritizing objective data collection. Another incorrect approach would be to use a highly intrusive observational method in a sensitive situation, such as prolonged direct observation that causes significant stress to the animal. This violates the ethical principle of minimizing harm and distress, which is a cornerstone of responsible animal behavior consulting. It also compromises the validity of the data collected, as the animal's behavior may be altered by the observer's presence. Finally, an approach that neglects to consider the specific context of the behavior, such as observing a dog in a sterile, unfamiliar setting when the problem behavior occurs at home, is also flawed. This leads to a lack of ecological validity, meaning the observed behaviors may not accurately reflect those occurring in the animal's natural environment, thus hindering the development of effective, context-specific interventions. This represents a failure in applying sound scientific methodology. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the presenting problem and the animal's history. This is followed by an evaluation of the available observational methods, considering their strengths, weaknesses, and suitability for the specific case. Ethical considerations, including the animal's welfare and the potential impact of the observation, must be paramount. The chosen method should be the one that yields the most objective and relevant data while minimizing stress and ensuring the safety of all involved. This iterative process of assessment, method selection, data collection, and analysis ensures that interventions are grounded in evidence and ethically sound. Question 16. Quality control measures reveal that a significant portion of client consultations involve inquiries about a training technique that was widely popular and considered standard practice several decades ago, but for which contemporary scientific research offers limited support and raises welfare concerns. When advising a client on this technique, which approach best aligns with current professional standards for an American Veterinary Society of Animal Behavior consultant? Option A. Advise the client to avoid the technique solely because it is an outdated method, without further investigation into its specific merits or drawbacks. Option B. Advise the client based on the historical prevalence and anecdotal success of the technique, as it was the standard of care for many years. Option C. Recommend the technique, but caution the client that it is an older method and may not be as effective as newer approaches. Option D. Critically evaluate the technique by researching its historical context, and then thoroughly assessing its efficacy and welfare implications based on current scientific literature and ethical guidelines. The correct answer is B. Advise the client based on the historical prevalence and anecdotal success of the technique, as it was the standard of care for many years. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal behavior consultant to critically evaluate the historical context of a widely accepted training method. The challenge lies in moving beyond anecdotal evidence or tradition to a more evidence-based approach, which is crucial for ethical practice and client welfare. Professionals must be able to discern between methods that are historically prevalent but potentially outdated or harmful, and those that are supported by current scientific understanding. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the application of current, evidence-based understanding of animal behavior and learning theory. This aligns with the ethical obligations of an animal behavior consultant to provide advice that is scientifically sound, promotes animal welfare, and is effective for the client. By questioning the historical basis of a method and seeking contemporary research, the professional demonstrates a commitment to continuous learning and the highest standards of care, which is implicitly expected within the framework of professional animal behavior consulting. Incorrect approaches analysis. One incorrect approach fails by relying solely on the historical prevalence of a technique. This is a regulatory and ethical failure because it prioritizes tradition over scientific validity and animal welfare. Historical acceptance does not equate to efficacy or ethical soundness, and a professional is obligated to provide advice based on current knowledge, not just what has been done in the past. This approach risks perpetuating potentially harmful or ineffective practices. Another incorrect approach fails by dismissing a method solely because it is old. While critical evaluation is necessary, outright dismissal without considering the underlying principles or any supporting contemporary research is not a sound professional judgment. This approach can lead to overlooking potentially useful techniques or misinterpreting their historical application. Ethical practice requires a nuanced evaluation, not a blanket rejection based on age. A third incorrect approach fails by assuming that all historical methods are inherently flawed. This represents a bias that can hinder objective assessment. While historical perspectives are important for understanding the evolution of the field, a professional must evaluate each method on its own merits, supported by current scientific evidence, rather than making broad generalizations about historical practices. This can lead to overlooking effective strategies or misapplying current knowledge. Professional reasoning. Professionals should approach such situations by first understanding the historical context of a behavior modification technique. This involves researching its origins, the theoretical underpinnings at the time of its development, and its evolution. Subsequently, they must critically evaluate this historical information against current scientific literature, research findings, and established principles of animal behavior and learning. The decision-making process should prioritize animal welfare, client goals, and the most effective, humane, and evidence-based strategies available today. This involves a continuous cycle of learning, critical appraisal, and application of knowledge. Question 17. The investigation demonstrates that a client's dog exhibits increased panting, lip-licking, and avoidance behaviors when presented with novel objects, alongside a history of gastrointestinal upset. Which approach best reflects a comprehensive and ethically sound assessment of the dog's physiological and psychological responses to stress, adhering to the principles of the American Veterinary Society of Animal Behavior? Option A. Focus solely on managing the avoidance behaviors through positive reinforcement for calm responses, without investigating the physiological indicators or potential medical links to the GI upset. Option B. Conduct a thorough behavioral history, observe the dog's reactions to various stimuli including novel objects, consider the reported physiological signs of stress, and recommend a veterinary examination to rule out underlying medical causes for the GI upset and stress responses. Option C. Recommend immediate desensitization and counter-conditioning protocols for novel objects, assuming the gastrointestinal upset is unrelated. Option D. Advise the client to administer over-the-counter calming supplements and increase the dog's exercise, as these are general stress-reducing strategies. The correct answer is C. Recommend immediate desensitization and counter-conditioning protocols for novel objects, assuming the gastrointestinal upset is unrelated. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal behavior consultant to interpret complex physiological and psychological indicators of stress in a client's pet. The challenge lies in distinguishing between normal behavioral fluctuations and clinically significant stress responses, and then translating these observations into actionable, evidence-based recommendations that are both effective and ethically sound, considering the welfare of the animal and the client's capacity to implement the advice. The consultant must navigate potential client expectations, the limitations of observational data, and the need for a holistic approach that considers the animal's environment and history. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment of the animal's stress. This involves not only observing overt behaviors, but also considering subtle physiological cues and the animal's overall psychological state. By integrating information from multiple sources, owner report, direct observation, and potentially physiological data if available and appropriate, the consultant can form a more accurate diagnosis of the stressor and its impact. This aligns with the ethical imperative to act in the best interest of the animal's welfare, as guided by the American Veterinary Society of Animal Behavior, AVSAB, principles, which emphasize evidence-based practices and a thorough understanding of animal behavior and physiology. The focus on identifying the underlying cause and developing a tailored intervention plan demonstrates a commitment to effective and humane behavior modification. Incorrect approach is analysis. One incorrect approach fails by focusing solely on observable behaviors without considering the underlying physiological or psychological components of stress. This is a regulatory and ethical failure because it risks misinterpreting the animal's state, potentially leading to ineffective or even detrimental interventions. Stress is a complex phenomenon with both behavioral and physiological manifestations, and a purely behavioral approach may overlook critical indicators or misattribute causes. Another incorrect approach is to recommend a generic, one-size-fits-all intervention without a thorough assessment of the individual animal's specific stressors and responses. This is a regulatory and ethical failure, as it contravenes the principle of individualized care and evidence-based practice. AFSEB guidelines emphasize tailoring interventions to the specific needs of the animal and the context of its environment. Generic advice can be ineffective, frustrating for the client, and may not address the root cause of the stress, potentially exacerbating the problem. A third incorrect approach involves making definitive diagnoses or prognoses based on limited information, or without consulting with a veterinarian when medical issues could be contributing to the stress. This is a significant regulatory and ethical failure. Animal behavior consultants are not veterinarians and should not diagnose medical conditions. The AFSEB position statements and ethical guidelines strongly advocate for collaboration with veterinary professionals to rule out underlying medical causes for behavioral issues, as pain or illness can manifest as stress-related behaviors. Professional reasoning. Professionals should approach such situations by first establishing a clear understanding of the client's concerns and the animal's history. This is followed by a systematic assessment that includes direct observation of the animal in its environment, detailed questioning of the owner about the animal's behavior, and consideration of any relevant physiological indicators. The consultant must then synthesize this information to identify potential stressors and the animal's stress response patterns. Crucially, if there is any suspicion of a medical component, referral to a veterinarian is paramount. Based on the comprehensive assessment, a tailored, humane, and evidence-based intervention plan should be developed, with clear communication to the client regarding expectations, implementation, and follow-up. This process ensures that the animal's welfare is prioritized and that interventions are both effective and ethically sound, adhering to the standards set by organizations like AFSEB. Question 18. The assessment process reveals a 3-year-old mixed-breed dog exhibiting extreme fearfulness and reactivity towards strangers and novel objects, often escalating to lunging and barking. The owner reports that the dog was a rescue with an unknown history prior to 6 months of age, at which point it was adopted. The dog has received consistent positive reinforcement training and has had ample opportunities for socialization with familiar dogs and people in controlled environments. Given this information, which of the following represents the most comprehensive and ethically sound approach to understanding and addressing the dog's behavior? Option A. Focus exclusively on identifying and modifying environmental triggers and management strategies, assuming the behavior is entirely a product of the dog's unknown past experiences and current environment. Option B. Recommend immediate and intensive counter-conditioning to all stimuli, without further investigation into the specific contributing factors, as this is a universally effective technique for fear-based behaviors. Option C. Prioritize a thorough investigation into the dog's potential genetic predispositions for fear and reactivity, considering breed influences and potential inherited temperament traits, while also integrating environmental factors into the assessment and intervention plan. Option D. Conclude that the dog's behavior is primarily due to an untreatable genetic predisposition, limiting interventions to containment and owner avoidance of triggers. The correct answer is A. Focus exclusively on identifying and modifying environmental triggers and management strategies, assuming the behavior is entirely a product of the dog's unknown past experiences and current environment. Explanation. The assessment process reveals a complex case where a dog exhibits severe reactivity and fear-based aggression. The challenge lies in disentangling the relative contributions of genetic predispositions and environmental influences on the dog's current behavior. A professional behavior consultant must navigate this by gathering comprehensive history, conducting thorough behavioral observations, and considering the interplay of both factors without overemphasizing one to the exclusion of the other. The correct approach emphasizes a holistic evaluation, recognizing that genetics provides a blueprint, but environmental factors shape its expression. This aligns with best professional practice by acknowledging the multifactorial nature of behavior and avoiding simplistic diagnoses. It allows for the development of a tailored intervention plan that addresses both potential genetic predispositions, e.g., by managing arousal levels, providing appropriate outlets for innate behaviors, and environmental triggers, e.g., desensitization, counter-conditioning management strategies. This approach is ethically sound as it prioritizes the animal's welfare by seeking to understand the root causes of behavior for effective treatment. An incorrect approach that solely attributes the behavior to genetics fails to acknowledge the significant impact of learning, socialization, and management. This can lead to a fatalistic outlook and a lack of effective intervention, potentially resulting in the dog being surrendered or euthanized unnecessarily. Ethically, this is a failure to provide competent care and to explore all avenues for behavior modification. Another incorrect approach that dismisses genetics entirely and focuses exclusively on environmental manipulation might overlook underlying sensitivities or predispositions that make the dog more vulnerable to negative environmental influences. While environmental modification is crucial, ignoring potential genetic factors can lead to an incomplete understanding and an ineffective treatment plan. This can result in frustration for the owner and continued suffering for the animal, representing a failure in professional duty. A third incorrect approach that relies on anecdotal evidence or popular but unsubstantiated theories about behavior without grounding in scientific literature or a systematic assessment is professionally irresponsible. This can lead to the implementation of inappropriate or even harmful interventions, violating the core principles of evidence-based practice and animal welfare. The professional decision-making process for such situations involves a systematic approach. 1. Comprehensive history taking. Gather detailed information about the dog's lineage, if known, early life experiences, socialization, training history, diet, health status, and the specific behaviors observed, including triggers and context. 2. Behavioral observation. Conduct direct observation of the dog in various settings to assess its temperament, reactivity levels, coping mechanisms, and response to stimuli. 3. Differential diagnosis. Consider all potential contributing factors, including medical conditions, pain, genetic predispositions, and environmental influences. Rule out medical causes with veterinary consultation. 4. Evidence-based intervention planning. Develop a behavior modification plan that is tailored to the individual dog, incorporating management strategies, desensitization and counter-conditioning, and addressing any identified environmental stressors, while also considering how to support any potential genetic predispositions. 5. Ongoing assessment and adjustment. Continuously monitor the dog's progress and adjust the intervention plan as needed, maintaining open communication with the owner and veterinary team. Question 19. Performance analysis shows a consultant is presented with 3 cases: a young Labrador retriever exhibiting mouthing behaviors, a kitten showing fearfulness around novel objects, and a juvenile parrot beginning to mimic sounds. Considering the distinct developmental trajectories of these species, which approach best reflects a professional and ethical assessment of their behavioral milestones? Option A. Focus on the most common or widely discussed behavioral challenges for each species, assuming that any deviation from these popular narratives indicates a developmental issue. Option B. Compare the observed behaviors against established, species-specific developmental milestones for canines, felines, and cetaceans, respectively, to determine if they fall within typical ranges for their age and developmental stage. Option C. Apply a generalized timeline of juvenile behavioral development, assuming that common developmental stages are largely consistent across mammals and birds. Option D. Prioritize the owner's perception of the behaviors as problematic, using their subjective descriptions to guide the assessment of developmental appropriateness. The correct answer is B. Compare the observed behaviors against established, species-specific developmental milestones for canines, felines, and cetaceans, respectively, to determine if they fall within typical ranges for their age and developmental stage. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal behavior consultant to accurately assess and interpret developmental progress across different species, recognizing that normal behavioral milestones are species-specific and can vary within populations. Misinterpreting these milestones can lead to inappropriate interventions, potentially causing harm or failing to address underlying issues. The consultant must rely on established scientific literature and their own expertise to differentiate typical developmental stages from concerning deviations. Correct approach analysis. The correct approach involves a comparative analysis of documented behavioral milestones for each species involved, considering the individual animal's age, breed, if applicable, and environmental context. This aligns with best professional practice by ensuring that assessments are grounded in species-appropriate ethology and developmental psychology. The American Veterinary Society of Animal Behavior, AVSAB, emphasizes evidence-based practices, and this approach directly reflects that by utilizing established scientific understanding of animal development. Ethically, it prioritizes the welfare of the animals by avoiding misdiagnosis and ensuring interventions are tailored to their specific needs. Incorrect approaches analysis. One incorrect approach would be to apply a generalized developmental timeline across all species without considering species-specific differences. This fails to acknowledge the vast diversity in canine, feline, and avian development, leading to potentially inaccurate assessments and inappropriate recommendations. This is an ethical failure, as it risks misinterpreting normal species-specific behaviors as problematic, potentially leading to unnecessary or harmful training interventions. It also violates the principle of evidence-based practice by ignoring established ethological data. Another incorrect approach would be to solely rely on anecdotal evidence or owner reports without cross-referencing with scientific literature on species-specific milestones. While owner observations are valuable, they can be subjective and influenced by human biases. Without a scientific framework, this approach risks misinterpreting normal developmental variations as behavioral issues. This is an ethical failure because it prioritizes subjective input over objective, scientifically validated information, potentially leading to misdiagnosis and ineffective or detrimental interventions. A third incorrect approach would be to focus on a single, highly publicized or popular training method as the primary diagnostic tool, irrespective of the species' developmental stage. This approach is flawed because it prioritizes a specific methodology over understanding the underlying behavioral needs and developmental trajectory of each animal. It is an ethical failure, as it can lead to the misapplication of techniques that are not developmentally appropriate or species-specific, potentially causing stress or hindering natural development. Professional reasoning. Professionals should approach such situations by first identifying the species involved, and then consulting reputable, peer-reviewed scientific literature and established behavioral resources specific to each species' developmental stages. This includes understanding typical ages for socialization, learning critical skills, and exhibiting species-typical behaviors. The next step is to gather detailed history from the owner, observing the animal's current behavior in its environment, and then comparing these observations against the species-specific developmental benchmarks. Any discrepancies or concerns should be further investigated through observation and potentially diagnostic assessments, always prioritizing the animal's welfare and employing evidence-based interventions. Question 20. Operational review demonstrates that a client is seeking assistance with their dog's persistent barking. The client expresses frustration and a desire for immediate solutions, stating they have tried various methods with little success. They provide a general description of the barking, mentioning it occurs when the doorbell rings, when strangers are visible, and at seemingly random times. The consultant is tasked with developing an initial strategy. Which of the following approaches best aligns with the ethical and professional standards for developing an effective behavior modification plan? Option A. Create a broad list of potential barking triggers and offer a generic set of barking cessation techniques that can be applied across various situations without specific operational definitions for the observed behaviors. Option B. Immediately implement a series of counter-conditioning exercises targeting the doorbell and visual stimuli, while also suggesting management techniques for the random barking, without formalizing observational data collection. Option C. Rely solely on the client's anecdotal reports of the barking incidents to create a behavior modification plan, assuming their descriptions are comprehensive and accurate. Option D. Develop a detailed ethogram with clearly defined, observable behaviors, including specific criteria for frequency, duration, and context, and then use this tool to systematically collect data on the dog's barking before designing any intervention. The correct answer is B. Immediately implement a series of counter-conditioning exercises targeting the doorbell and visual stimuli, while also suggesting management techniques for the random barking, without formalizing observational data collection. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal behavior consultant to balance the immediate needs of a client and their pet with the ethical imperative of developing a robust, scientifically sound ethogram. The client's desire for quick solutions, coupled with the potential for misinterpretation of behaviors without a standardized observational tool, creates pressure to deviate from best practices. Careful judgment is required to educate the client on the importance of systematic data collection, while still offering supportive guidance. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the development and application of a well-defined ethogram as the foundation for effective behavior modification. This aligns with the core principles of the American Veterinary Society of Animal Behavior, AVSAB, which emphasizes evidence-based practices and a systematic approach to behavior assessment. A detailed ethogram ensures objective data collection, reduces observer bias, and allows for accurate identification and categorization of behaviors. This systematic approach is crucial for developing targeted and effective intervention plans, ultimately leading to better welfare outcomes for the animal and greater client satisfaction based on measurable progress. It demonstrates a commitment to professional integrity and scientific rigor. Incorrect approaches analysis. One incorrect approach fails by immediately proposing interventions without a formal ethogram. This is a regulatory and ethical failure because it bypasses the essential step of objective behavioral assessment. Without a clear understanding of the frequency, duration, and context of specific behaviors, any proposed interventions are speculative and may be ineffective or even counterproductive, potentially exacerbating the problem or causing distress to the animal. This approach lacks scientific validity and deviates from the evidence-based principles expected of a certified professional. Another incorrect approach is to rely solely on the client's subjective descriptions of the animal's behavior. While client input is valuable, it is inherently prone to bias, misinterpretation, and incomplete reporting. An ethogram provides a standardized, objective framework for observation, ensuring that all relevant behaviors are captured consistently. Failing to implement an ethogram in favor of subjective accounts is an ethical lapse, as it compromises the quality of the assessment and the efficacy of the subsequent behavior plan, potentially leading to suboptimal outcomes for the animal and a breach of professional duty to provide competent services. A third incorrect approach involves creating a very basic, generalized list of behaviors without specific operational definitions or context. This is a failure because a truly effective ethogram requires precise definitions of each behavior, including observable actions and their typical antecedents and consequences. A generalized list lacks the specificity needed for reliable data collection and analysis, rendering it insufficient for developing a targeted and effective behavior modification plan. This approach falls short of the rigorous standards required for professional behavior consultation. Professional reasoning. Professionals should approach such situations by first acknowledging the client's concerns and desire for immediate assistance. However, they must then clearly articulate the necessity of a systematic assessment process, explaining how an ethogram serves as the essential tool for objective data collection. The decision-making process should involve educating the client on the benefits of an ethogram, collaboratively developing one that is relevant to the specific case, and then using the collected data to inform the development of a tailored intervention plan. This iterative process of assessment, intervention, and reassessment, grounded in objective data, is the hallmark of ethical and effective animal behavior consulting.